Yeah, thank you very much indeed. I'm very grateful for the opportunity to come along and give a perspective on this issue from the community pharmacist and probably the primary care health professional, if you like, point of view. As John said, despite our name, we don't represent the pharmaceutical industry. We represent community pharmacists across a broad spectrum of European countries. I'm also very glad that I got the opportunity to follow Hugo, because Hugo brought out two of the points that I want to make in my presentation. He asked the question, why is this problem, for example, over-the-counter dispensing, not such a serious problem in the Netherlands? Why don't you have such a serious problem in the Netherlands? Why can't more countries be like the Netherlands? Well, two reasons leapt to my mind. There are probably many others, but two amplified points I want to make in my presentation. Firstly, in my understanding, in the Netherlands, you have a relatively strong and vigorous healthcare inspectorate, and enforcement of rules is a big issue. You have to bear in mind that, for example, when you look at an issue of dispensing antibiotics, OTC, that is a problem of illegality. Let's not mince words about it. Dispensing antibiotics, OTC, is illegal in all of the 28 member states. The problem, and the more difficult issue, might be why in some countries it is allowed to continue at relatively high levels and other countries at low levels. The second point, which is an interesting feature of the Dutch system, which again I'll refer to in my presentation, is that the Netherlands, by far and away, compared to almost any other European country, has relatively high levels of cooperation between primary care health professionals, particularly between physicians and pharmacists. You may not think it's so systematic as all that, but it is at a more advanced level than many, or the majority, I'd say almost all European Union countries. And one of the issues that I wanted to mention in my presentation is when you look at something like antibiotic stewardship, which has been, as I understand it, quite successful in secondary care sectors. How do we transfer and replicate some of the positive features of antibiotic stewardship into the primary care sector, where in Europe, in almost every country, for example, pharmacists and physicians carry on their practice in silos and only communicate, if they communicate at all, in an informal manner, not in a systematic manner at all. And I think, John, you made a point in your comments earlier about how that might be addressed. And I think this is an interesting issue which we might want to take forward, and I'll mention that. So firstly, the problem, it's not obvious to everybody in the room, but not obvious to, I suggest, the man and woman in the street, that this is also a problem of the community. It's not purely a problem of hospitals. We hear a lot of stories in the newspapers about superbugs in the hospital setting, but these statistics show that there is a clear correlation between the development of resistance in the community with the consumption of antibiotics in the community too. So let's not be in any doubt about this. When we think about this problem, we have to get away from just thinking about secondary care settings and get out in the community too. Now, illegal dispensing, I won't mince words about this. We utterly condemn it. I won't make any attempt in this forum or any other forum to defend illegal dispensing. It does go on. It goes on in more countries than the others. These are the Eurobarometer statistics that Anna referred to in her presentation. There's 2002, 2009. You see, Anna was a little bit negative about whether there'd be many developments. You do see some positive developments in countries like Spain, which I'll come back to. There is another Eurobarometer report which is about to come hot off the presses, and it'll be interesting to see what that says about this. So there is a problem, and obviously we need to think of ways to address it. Now, the title of my presentation referred to dispensing and prescribing rules at EU level. Well, two things about this. Traditionally and legally, the EU has relatively limited competence in going into the dispensing and prescribing and retailing, is another word that was used in the title of my presentation, area. As I've said before, everywhere, this is not so much a question of the existing rules and guidelines, because in many countries there are rules, there are clear rules about dispensing antibiotics OTC, for example, and there are guidelines. Anna referred to the guidelines in her presentation. This is substantially a question of why more pharmacists who are doing this illegal activity aren't caught doing it, aren't brought to book for doing it, and that is something we need to think about. Second, but why exactly does it happen? Why, if you go to Greece and Romania and certain other countries, particularly in the south of Europe and to some extent in the Baltic states, for example, do you see this more activity more than others? Well, there are probably a variety of reasons. One reason which was brought out a couple of years ago in a study from Catalonia in Spain was suggesting that this is basically financially motivated. I don't have the reference for the study here, but what the researchers did is they looked at bigger and smaller pharmacies in Catalonia, pharmacies with relatively low turnovers and pharmacies with higher turnovers, and found that there was a correlation between the willingness of pharmacists to dispense OTC and the turnover of the pharmacists. If so, that's quite alarming in some respects, because turnover of pharmacies generally is falling in Europe. But I wonder whether, too, there's an element of where you have a pharmacy in a country area, a small village, for example, where you will necessarily have a smaller turnover, there is also less likely to be a prescriber in easy reach. And there's also likely that the pharmacist in those circumstances knows very, very well his patients, has been treating the same patients for 10 and 15 years. And in those circumstances, it might be more difficult to change the expectations that the patients have when they go into the pharmacy. I mentioned there about the point about enforcement, so that just echoes that. Going back to the example of Spain, where you saw some reduction in illegal dispensing between the Eurobarometer study in 2002 and the Eurobarometer study in 2009. In that period, there was a fairly sustained campaign involving the Spanish authorities and the Spanish pharmacists to raise awarenesses of the issue. And that points perhaps to the fact that if health professionals are prepared to take the battle forward, as it were, both to the public and, more importantly, even to their own constituency, the pharmacists within their own associations, then progress can be made. So I take that Spanish statistic, even though Anna was quite negative about the overall statistics, as positive news that something can be achieved. Now, talk a little bit about prescribing, because dispensing is one part of it. We can't ignore the prescribing aspect too. I picked this up 2 weeks ago. This is from Ireland, a study which was published and got onto the front page of the Irish Independent. You see there, suggesting that doctors are blamed for the rise of superbugs. The report goes on to suggest that general practitioners in Ireland are prescribing antibiotics needlessly. Now, well, whatever the truth of the report, I haven't read the study myself, I do think this is a slightly under-researched aspect of the problem. That's not to play down, I must stress to you, the importance of tackling illegal dispensing. But I think we need to think more about why, where studies have been made, there has been examples within the European Union of unnecessary and what you might call imprudent prescribing on behalf of prescribers. The EU tender, which is being considered at the moment, very, very important, a substantial amount of money looking into the self-medication issues and illegal dispensing issues, not looking so much, as I understand it, on the problem of imprudent prescribing. I would suggest to you a little bit of an imbalance there. Why is there imprudent prescribing? Well, multifactorial, obviously, unrealistic patient expectations of what they should take away from a medical visit. And also things like delayed prescriptions, which my doctor in Belgium gives me, and I know is a feature of prescribing in the UK, where a patient will go into the doctor's surgery with probably a self-limiting condition, and the doctor will say, well, take such and such OTC medicine for 3 days. If it doesn't go away, I'll give you a prescription for an antibiotic anyway, in effect, leaving a decision about whether to take the antibiotic to the patient. The Irish study made 2 interesting points. Firstly, it said that in Ireland, you have to, in general, pay €50 for a physician visit. So if you're going to see a physician and you lay an unreimbursed €50 note on the counter, and the doctor says, well, actually, I can't do anything for you, I'm not going to give you a prescription, but I'm going to take your €50 anyway, that counts, perhaps strikes some patients or consumers as a little bit counterintuitive. If you go to the doctor, why should I leave empty-handed when I'm basically feeling ill? The second point that comes out in the study, and this is from the reports of the study, I stress I haven't read the study itself, is that while there are guidelines in Ireland, they are not being enforced properly enough. And that comes back to the point, just to echo for the final time in this presentation, that enforcement is an absolutely crucial area here, and perhaps an area which doesn't get the attention it deserves. Finally, I'll make a general point about a phenomenon which is general across the European Union, probably beyond, which is the preference of many patients to opt to go to a physician for so-called minor elements or other ailments, or otherwise self-limiting conditions. These are statistics which are produced, again, just a couple of months ago by the Brussels think tank Opposi, looking at the proportion of patients who visit GPs for minor ailments. That's self-limiting ailments which can probably be self-treated or treated with a OTC medicine. And you'll see up to 2/3 in some countries. So that's a significant problem. In general, if we could move away, some patients away from seeing physicians, going into the prescribing area, if you like, where they're more likely to get an antibiotic prescription for a condition which doesn't need to be treated by antibiotics. So, a few suggestions for the ways forward. This is a nice poster which was produced by the Irish Pharmacy Union in cooperation with a couple of other organisations. Taking antibiotics for cold and flu, there's no point. Absolutely, we echo that. Public awareness campaigns probably do work. There is some evidence. There's a study which was produced a few years ago in the UK which says that public awareness campaigns in themselves probably aren't enough. The patients tend to get them relatively quickly, and you should probably get health professionals involved too and aimed your publicity campaigns at health professionals as well. As I said in my introductory remarks, the stewardship concept is an excellent concept, and as I understand it, it works relatively well. But of course, it's going to work better when you have health professionals working literally side by side in hospitals in an entirely integrated or substantially integrated environment, better than where you have health professionals in the community where the pharmacist and the physician only contact each other, where the pharmacist can't read the physician's handwriting, for example. There's some excellent examples of campaigns at national level. I showed you the one from Ireland, very good in the Czech Republic, Belgium. I could go on. And again, I'll put up my cards on the table here. ECDC has been working away on this issue for a number of years, and the Antibiotic Awareness Day. I honestly don't think the response from health professionals, and I say openly, honestly to you in all candor, by pharmacists themselves has been good enough yet. This is an obvious opportunity for pharmacists. Whether you have a problem in your country, whether you're Netherlands or whether you're Romania, it doesn't really matter, because the message needs to be got out there. And what we'd like to see in future is that more health professionals, and particularly our profession, use this fantastic arena they have, all these people going through their pharmacies day in, day out, much more often than they go to any other health setting, to get these messages across. I think it's been disappointing so far, and I'll end on a positive point that European Antibiotic Awareness Day 2014 will focus on the self-medication issue. I'll come back to one of these fora in 2015 and 2014 and hopefully be able to tell you that the overwhelming majority of European pharmacists use the opportunity they have and the moral duty, I would say, they have to start getting these messages across. Thank you.